Hello friends, welcome to Creative Medicine. In this lecture, we will learn about. Hello friends, let us now learn some important points about plasma calcium first. First, calcium. If you see, total almost 1 kg of calcium is present. Among that, we have two types of calcium. One, we have skeletal calcium, and second, we have non-skeletal calcium. Skeletal calcium is the one which is present in bones, which accounts to 99%. Non-skeletal calcium will be 1%. Then if you see non-skeletal calcium will be again divided into the calcium in the intracellular fluid and in the extracellular fluid. Intracellular fluid storage was 0.91%, extracellular is 0.1%. Intracellular is 0.9%, extracellular is 0.1%. This extracellular fluid will maintain plasma concentration of 10 milligrams per deciliter, or it maintains plasma concentration of 5 milliequivalent per liter or 2.5 millimoles per liter. Okay. So among this 10 milligrams, if you see, this is extracellular fluid or plasma calcium, right? So this plasma calcium is nothing but 10 milligrams per deciliter. Among this 10 milligrams per deciliter, if you see, protein bound is 40% is protein bound, whereas non-protein bound is 40%. Non-protein bound is 60%. Non-protein bound are also called as filterable calcium. So this non-protein bound and filterable calcium is again of two types. One, it is phosphate bound. Phosphate bound becomes 10%. Whereas free, phosphate bound is 10%, free or ionized calcium will be 50%, and this is active calcium. Okay, so this is how the calcium is present in our body. Thank you for watching.
Thank you, and thank you for watching.